Hello, health sciences and nursing students. I am the Associate Provost over our division. My name is Christy Marceau, if you've not met me before. And I wanted to get out a quick video message to you guys to kind of let you know what's going to happen going forward. So your instructors and your program directors and leads, etc., have been working very closely with me during the week that you guys were off on spring break, and we started back up again today. Classes will resume for you on Wednesday online. No one will report to campus in person on Wednesday, but classes will resume, and your instructors will be reaching out to you via Canvas, probably to show you this message, but also to tell you what to expect. But I'm going to give you a general overview right now. So basically, we have adapted all of our future classes to an online or remote platform through Canvas. The platform that you already use will be added. We've added some tools and integrated some other software so that we can do live streaming, lecturing, so that we can give you assignments and have you upload things back to us, etc., from a distance while you are in your stay-home order from the governor. We will not be going to clinical sites at this time. I'm hoping that as things progress, that may become a possibility, but we have a plan in place that we are still working on and will continue to adjust and regroup on every day from here till the end of the semester, and we are committed and dedicated to getting you to finish the semester and or your program, depending on where you are in your career with NTCC. Seniors, please don't worry. We're going to work with you, and we're going to make this happen so we can progress you to completion on time. That is our goal. Barring anything that is completely out of our control, everything that we can do, we are doing in order to provide you with the education that you need to be successful in passing your boards or your certifications that you should have finished in May to do. We will be doing it differently than what was expected. So everything is being looked at, everything is being revamped, and everything is being replanned on an ongoing basis. So we ask that you bear with us, that you have patience, and that you highly communicate with your instructors. There is no such thing as over communication as long as you're doing it respectfully via email and allow them to call you back at their convenience and help them to schedule, because there's a lot of you and just few of them. We will be doing simulation, online virtual reality simulation, where it is available for the programs that we have. That includes nursing. We'll be doing some things with CNA, MA, and PCT that will be more online driven and simulation oriented. Vet Tech, you're primarily online, so we'll add things as we need to that make it impossible for you to come to campus. And CDYC, we are looking at purchasing some things as well to utilize in your program for observation. So we are on all of it. We are planning as well as we can. We are looking for any resources that are available, and we have a whole lot of support and assistance with our college administration at large, as well as our LCTCS system at large throughout the state. So what I'm going to ask you to do is to be patient, to relax, and there's a couple of things that are going to be definitely your responsibility. Those are to check your school email address, the my.northshorecollege.edu address that you've gotten since you registered for school. We really need you to convert to using that email for everything you do with us and not try to use a private email, because that's how we're going to be communicating. We will communicate with you with announcements through Canvas, as well as emails through your North Shore College email. So we need you to check those not just once a day, but several times throughout the day. The other thing that we want to say is that when we create an assignment or post a lecture or put a time down that something must be done through a group video conferencing call or through uploading documents or whatever, any issues you're having in real time, you need to reach out to your instructors and let them know you're having issues so we can help and assist you in overcoming whatever challenges you are having. We are sending out in Canvas an announcement with this video, as well as a couple of documents. One of the documents is asking you about your ability to connect with us remotely via online systems. So please answer those honestly and get them back to us as soon as possible so that we can see who we have to help in whatever ways possible that have issues or challenges overcoming that. We will be trying to hold class at the usual class times with some exceptions, but you will get clear messaging from your instructors as to what is due, what you're expected to attend via online, and we will eventually likely bring in very small groups of clinical students of all kinds to come in to do their validation and competency checkoffs in a very controlled environment as time, space, coordination, and the most current advising allows us to do in this COVID-19 crisis. So I just want to give you the message that we are here for you. We are planning like crazy to make sure we can keep you on track. And we just need you to do your part in communicating clearly, following directions, participating in everything that we're doing, and adapting with us to what's this new environment. School will not look like it has looked prior to this for the rest of this semester, but we will make it work, and we will make sure that you finish with the skills that you need to finish with on time, as much as we possibly can control. So having said that, we need you to be flexible and adaptable. And those of you who have heard me speak in front of your class, it's one of the things I say immediately. In healthcare, the first skill you must learn is flexibility and adaptability. And I'm here to show you why. Because right now, as the world is shutting down, who's still out there as healthcare workers doing their thing? So flexibility and adaptability to any given situation is a must in healthcare. And so this is a good educational process for you to go through to understand that. There's not a whole lot more to be said except check your Canvas, check your email, and follow all the instructions of your instructor and communicate openly. Having said that, our administrative assistants that you often seek for help will be working from home as well, taking phone calls and emails. So if it's something that you think they can help you with, certainly reach out to them as well. Some of you already know how to do that. Otherwise, speak with your instructors, your PIPAs, and your lead instructors or program directors or coordinators for anything that you need. And you're also welcome to reach out to me. But I would like you to follow that chain of command. So we're in this together. We're going to make it through this together. And we just ask that you do your part, that you take responsibility and accountability for what is asked of you, and to go ahead and do that, and to communicate anything that comes up that challenges you or obstructs you from doing that. So again, we're all in this together. We're going to get through this. Everybody keep a positive attitude and let us know how we can help here at NTCC. Thank you for listening. Please reach out if you need to, and we're going to make it through. All right, good night.